Good afternoon. This is Kim Keebler. I am the editor-in-chief of the Multiple Chronic Conditions Resource Center, and we are proud today to invite Renee McDonald from Australia. She's joining us a day and a half in front of us, and I was just told that the World Cup is actually starting today at this time between Australia and America. So how appropriate is that? But to introduce Renee, she's a counselor, a psychologist, integrative coach, clinical supervisor, educator, and well-being innovator with over two decades of experience in mental health. Her work is grounded in a person-centered approach with a commitment to preventative mental health and well-being. She provides support before a crisis becomes the only doorway to care. She works across grief, loss, trauma, relationships, couple work, family systems, medical trauma, disenfranchised grief, practitioner development, leadership stress, and transformational growth. What is it that you don't do, Renee? She is the founder of the Wellbeing for Me, created to help people find personalized well-being that supports and meets individual needs, and the Australian online therapy training, where she has trained more than 1,000 clinicians in online therapy practice during the early stages of the COVID pandemic. Renee is the author of 2 books, Online Therapy, Process, Task, Integration, and Energetic Holding, and the best-selling book, Rising with Butterfly Courage, that uncovered the story behind her work, her research, and the journey of her life path that led her to being a therapist and lifetime coach. Thank you, Renee, for joining us today.
Thank you. Thanks for reading that out. It's a bit of a mouthful. Thank you for having me. Yeah.
Yeah, absolutely. And in providing an Australian perspective, you are actually our first behavioral health expert that we've invited to do a podcast. So we're really pleased that you bring a whole different perspective to this area of clinical practice. And I also know that you're also involved in other areas other than medicine, but from our previous discussions, we've talked a lot about person-centered care. Your approach to the patient or the client is through a behavioral health lens, and your expertise covers a wide array of settings such as personal, business, online, and educational, to name a few. Can you provide a brief overview of how you would define and implement person-centered care in your clients who are living with multiple chronic conditions?
Yeah, sure. There's so many layers to this, isn't there? Okay, so probably to kind of get a little bit more technical, I'm a clinical psychotherapist, not clinical psychologist, and that's a kind of it's a technical difference, but really I work long term with a lot of people, and because of what's happened with our Medicare, I know that in the US you guys have Medicare. We also have Medicare, but I actually don't get it. So the clinical psychologists get that, but the clinical psychotherapists don't get that here in Australia. So I've had to innovate because I don't really get much government funding. So for the start, I guess that's probably why I've done all the things that I've done, almost to innovate, to ensure that I'm providing the right care because I don't get that funding. And so that's probably the lens I start with first. So that's even my own kind of behavioral lens to why I do the things that I do. So that's firstly. And then secondly is, the behavioral approach from even psychotherapy as well as counselling. It's always to treat the person in front of us first and then worry about the systems and behaviour second. So I probably have a reverse model, just thought process from the start anyway. So if we've got someone in front of me who's really struggling. So for example, I see people on the NDIS. And so the NDIS itself is the National Disability and Insurance Scheme. I get some funding for that, but it's like really piecemeal kind of funding. It's like the equivalent to your insurance funding, but instead we get it for people with disabilities. And so yeah, I've worked in the behavioural side of things because of the NDIS here in Australia, and so I can see someone with something like Crohn's. I could see someone with, and my one of my current clients has COPD. If you work with that, I'm not sure. So the multiple chronic diseases. I can talk specifically to one particular client I've been working with. So really, I take the lens that they are both an individual and part of the collective system of their family, and moving out from there. A lot of other approaches might take the kind of, the government system or the kind of broader system, but I actually usually look at the individual as like a microcosm of a larger system. And so I work with whatever that person actually needs me to work with them on. That can be multiple things. Yeah?
So you do individualized therapy based on that person, and that is what you consider as person-centered, that it's individual to that person.
Yes. Yes, absolutely. Mm.
And yes, COPD patients, they certainly have a lot of other things going on and are living with multiple chronic conditions. But so we talked about, focusing on the person or the individual. There are also emotional and existential issues that coexist with physical conditions such as obesity, diabetes, hypertension, osteoarthritis, COPD. Sometimes empowering patients to take control of their health and self-management can be a real challenge.
Yeah.
So, what suggestions or tips do you have for healthcare professionals or professionals in your discipline to help motivate and empower patients?
Yeah. The number one thing is empathy. This is like what I was originally trained in. And I guess the most difficult thing in the disease area and the kind of chronic condition areas is that often the practitioner themselves might not have experienced what the patient or the client, depending on how you're servicing someone, what you call your consumer, your health consumer, they might not have experienced what that person has experienced. One of the biggest things within the empathy place is that you're trying to walk in the other person's shoes. So what I actually really attempt to do in my work, it's quite simple but profound, is I imagine myself as them. I imagine myself walking as if I'm them, and then I try to imagine what life would be like with COPD, what life would be like with any of these other kind of conditions. Yeah. Mm.
So, how would you motivate them or empower them to be more in control of their own care?
Mm. Good question. The motivation piece usually comes from asking them. So I don't necessarily have a standard tick and flick box. In fact, I often throw those out the window. So that's a really radical approach. I know in healthcare settings it can be a radical approach to go, okay, let's just sit down and have this conversation. But I have, obviously I can get I might do the DAS 21, there's all those kind of, or any of those kind of anxiety and depression scales and those kind of things. That's the kind of area I work in that mental health style space. But really, at the end of the day, I'm looking at what is this person experiencing? What are they? What's actually going on for them? And I'll sit down with them and actually spend the time to say, well, what would best motivate you? How do you work best? It's a kind of almost a radical approach compared to a lot of health, is like looking at it going, well, okay, so how do you experience your condition? What do you do? Like day to day, how do you experience life? And what have you found works best with you? Um, and what would it be like to try this approach? Do you think that would fit for you? Or if that doesn't work, what would it be like to try this? So it's kind of rather than a one size fits all, I'm really looking at, well, okay, from your perspective, can you actually even do this to start with? Because if we just shove people in a box, often it doesn't work with when you've got chronic conditions.
Yeah, and that takes it back to that person-centered care, for
Yeah.
sure. Um, well, you already answered one of my questions at the beginning about your reimbursement mechanism, because I was going to ask about that since Australia's universal health system is called Medicare. In the US, we don't get Medicare until we're 65. Um, but are you routinely a member of the healthcare team? I mean, a patient, or, I know you call them clients, we call them patients. If there's somebody that's living with multiple conditions, are you part of that team, or do patients or clients come to you for support while they're trying to traverse, the journey of living with chronic conditions?
Yeah, very good question. Usually, I'm the person people think of the last. So they might have, obviously they have to go to hospital or they have to get treated by a doctor or another clinician. It's only just recently in Australia that we've been acknowledged. In America, you've got licensing for professional counsellors and the like, but it's only just recently that we've been acknowledged through things like victim services. So I get that funding. So I might end up coming across multiple issues and chronic conditions when and after someone sadly has been involved in domestic violence or some other kind of major trauma in their life, then that's when I'll be on their team. And then that's when they might then say, can you speak to my doctor? Or when, can you speak to my behavioural psychologist? So I'm not in that line of work, but I'll have to work alongside them, for example. So I'm usually the person people think of last, but I'm often the person who's um, uh, more valuable than people give me credit for because I'm actually often filling in the gaps with people. And so that's the kind of work that I do. So, if, for example, the regular health system, like the universal healthcare that we have, can't actually look after them, I'm often the one who fills in the gaps. Yeah.
And do you help with, finding external resources, community resources that can help patients and families?
Yes, yes, that's exactly what I do. So it's I can I'm actually quite wide and broad about what services I can do because of the person-centered approach that I take. And so and I was originally trained as a community advocate, so I have those skills too. It's why I can straddle all those different fences that you explained at the start. So yeah, it's like then I come at things from a completely different angle where it's okay, what hasn't the services offered you yet? How can we help you? And who do I need to refer you to? So even if I can't do it, I usually have to know, okay, well, that particular person can help you with this, that person can help you with that. I need to be across a wide variety of different things, probably more than most specialists. Yeah.
That makes sense. I appreciate the fact that you approach this with empathy, because I think that kind of puts you where the rubber hits the road, and being able to navigate patients and families. Um, we sort of talked about, just briefly communicating with the interdisciplinary team, but you mentioned that there's all kinds of tools and assessment parameters, for determining depression and all kinds of other diagnostics that we can put on something. But As we talk about patient self-management, empowering patients, person-centered care, I mean, what about the concepts of readiness to change, or are patients, are they ready to engage in making changes or improving their own health outcomes?
Yeah, I think that's a great question. Um, I come at that with the Prochaska and Norcross model. I don't know if you're aware of that model, the stages of change model, and so I actually do work with that. So, particularly, for example, occasionally I'll work with drug and alcohol, people with drug and alcohol issues as well. And so that's another kind of potential for chronic diseases as well in some respects. And so if there is anyone with drug and alcohol issues as well as relationship problems or grief or loss or trauma, then then I come at it from a different angle again, where I'll then look at their readiness to change and their capacity to even see that. So there's I mean, many people may or may not know this in your area, but the pre-contemplation and contemplation stage often, is like two steps forward, one step back kind of process, in the chronic diseases area, because really what is possible for them might you might be able to do some of the things, but if you kind of push it onto them, it might be that they literally cannot physically, mentally, or emotionally actually do the things you're asking them to do. So I think it's more than just do they have the capacity to change? Is it possible? And I think that's the question I regularly both ask myself and the client. So we're working out what's possible and what's not, really.
Right. I think about my own personal practice right now. I'm working with indigent patients, and a lot of them are Hispanic. I have to use an interpreter in my encounter. Lifestyle is the biggest problem, and sometimes culturally, trying to culturally change that, even though we're thinking about, are they engaged? Can they self-manage their care? Can they do all these things? And they come back, I recheck their labs, and they're still, they're still terrible.
Yeah.
It's challenging when we think about all these tools that we have, but the real world, even with empathy and empowerment of patients, I mean, it's their responsibility, and, you know, how do you hold them to the fire?
Yeah, great question. One of the biggest things that's coming to mind, but how I work, is asking them what's possible in your life. What are you coming in to see me for? And um, what are you hoping from this process so that you get an outcome that you want from this? So I do actually both challenge them. So in the psychotherapy realm, it's the Gestalt challenge. So you're kind of asking them what's possible in this immediate moment in time, what is actually possible in your life, and how do you want things to be, acknowledging that you've got this condition and concern, like what is possible and what would you like my help to do.
Yeah, so putting it back in their thought process to determine what direction to take.
Yeah.
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 So this well-being for me clinic,
mm,
describe what you do through Well-being in Me, and
mm.
your services, and what available resources are out there for your clients and other healthcare professionals.
Yeah, I love this question too. So um, my clinic is based in the centre of Wollongong, um, which is about 80 kilometres south of Sydney. If anyone knows their geography, Sydney's on the east coast of Australia. Um, so I'm at the same time zone and not far from there. But um, my clinic does a lot of different things. We provide counselling, psychotherapy services, We have massage people come in. I've had kinesiologists work for me, life coaching, business executive coaching. So we really kind of work with a lot of different types of people, both from, getting someone who might be on welfare payments. So I have people on welfare payments. They have to get government funding in order to see me, because otherwise it wouldn't work with their budget. So they might get what's called victim services, which is someone has had to experience some kind of trauma and some kind of police involvement, unfortunately. So the police in Australia can give some funding for that. And then there's also the NDIS people as well. So someone with disabilities might get funding for my services as well. But then also there's couples who are just having marital issues. I see them as well. And usually the couples that I see have some kind of level of complexity. I've majored in working with complex clientele. But really, I'm just working with people with just a lot of problems, and often might have struggled in other particular services. And so my clinic does well really to kind of fill gaps from the regular standard systems. And so that's kind of what my clinic does, yeah.
Well, it sounds like you're really busy. I wish I
Yeah,
had you to work with and collaborate with on some of this patient issues. So,
yeah.
Renee, what do you do for yourself? How do you take care of yourself?
Great question. We've all got to look after ourselves. So I have a trauma-informed yoga practitioner that I work with. I've got my own therapist. If you're a therapist like me, usually you should have a therapist, but not all therapists do, but I do. Um, I've got a coach as well. And I have a personal trainer. I love my personal trainer. And I have to say this out loud. If you can afford a personal trainer, I'd encourage you to get one. So yeah, that's really changed things for me in regards to my health and wellness. Yeah.
Well, if you're talking the talk, you got to walk the walk, right?
Yep.
Yeah.
Yeah.
Is there anything that you would like to share with our audience that we haven't discussed?
Um, just that if you don't find the right support to start with, then I'd encourage you to keep searching. I know in the US there's lots of different services. Same thing in Australia, like across the world, you you can search for someone different, and then you might be limited in your choices for funding and what have you. But I'm sure there will be other people you could possibly find to support you if you don't get what you need first. Most of my clientele, they've seen 4 or 5 psychologists or other counselors, or it pays to shop around, because only you know what you need. And particularly in the chronic diseases area, I've found the people who've found me, um, they really have had to shop around, and then so that you've got someone who's holding the space properly for you, who's getting you what you need, and also really cares about the outcomes for your health.
Yeah, that's really important. Well, we really appreciate you. We finally got our time zones coordinated,
Yes.
um, and that was a challenge. But
Yeah.
we appreciate all that you do in Australia, and hopefully we'll continue to collaborate on projects. And
Yeah.
we really appreciate you being with us today.
Absolutely. Thanks for having me on, Kim.
Absolutely.